Hi, Dr. McCarthy here, and we're going to present today's 12 Days of Christmas Health Success Tips. Today we're going to talk about the difference between the normal lab ranges and what we use here in our office called normal functional ranges. As you can see over my shoulder, the lab ranges in our consideration are way too broad. It's a very large range between the high end and the low end, and if we take, say, TSH for example, the normal lab ranges run from 0.5 on the low end all the way up to 5.0. And if you are at a 0.6, just slightly above the low end, or if you're at 4.9, just slightly below the high end, according to the labs and according to the traditional healthcare providers, you are normal. Well, we use a very much more narrow view of what normal is. Still keeping with TSH, we use 1.8 to 3.0. So you can see if you fall outside of our functional range, the labs would still say that you're normal, but we're able to pick up on a problem before it becomes an overt named disease process. And we do this with all of the different labs that we run. So we're able to see patterns. And if we see a couple of your lab tests are high on our functional range, yet your doctor will still say you're normal, and a couple of your lab tests come out on the low end according to the lab ranges, but they're outside of our functional norms, we're able to pick up patterns. When we look at a very broad, comprehensive blood work that we do, we're able to see things before your traditional healthcare provider can do that. So I encourage you, if you would like, you can bring in your last couple of labs, call our office, call Kathy, you'd like to set up some time to do that, and we can put your lab values through our functional ranges, a much narrower and a much more definitive range, so we see if we can pick things up before it gets too late. Give our office a call. I look forward to seeing you on the next health tip. Thanks.